Hepatitis C is a viral infection of the liver by the Hep C virus which causes liver inflammation. Hep C can occur as an acute or chronic infection which could lead to serious liver damage, developing into cirrhosis and even liver cancer. The Hep C virus is one of the 5 hepatic viruses, hepatitis A to E. The viral genome of Hep C, A, D, and E consist of a single-stranded RNA, while B consists of double-stranded DNA. Route of transmission of Hep A and E is fecal-oral, such as by ingesting contaminated water, while B, C, and D is blood-to-blood contact with someone infected with the virus, the major cause being the sharing of injection equipment during drug use. For Hep C, other routes include unsterile healthcare and piercings, blood transfusions in Australia before 1990, sexual practices that lead to blood exposure, and from childbirth if the mother is infected. The incubation periods, the time taken from infection to onset of symptoms, is quite varied, with Hep C being from 2 weeks to 6 months. The serology profile are blood tests used to diagnose which virus the patient is infected with by detecting respective antibodies. For Hep C, it's quite limited, with the anti-HCV vaguely indicating prior or current infection, while the other viruses have multiple immunoglobulins such as IgM to indicate recent infection.
Hey guys, I'm Dr. Doe and I'm here to speak to you guys about the epidemiology of hepatitis C, or Hep C. So worldwide, approximately 170 million people have Hep C, which is chronic in about 71 million people. At the end of 2016, the Australian Department of Health reported that about 199,400 people were living with chronic Hep C, and there were about 621 Hep C related deaths. About 13% of people with chronic Hep C had severe fibrosis and 8% had Hep C related cirrhosis in Australia. The prevalence of Hep C was also very high amongst people who injected drugs. The notification rate of Hep C was also 4 times greater among Indigenous Australians compared to the non-Indigenous population due to lower socioeconomic background and increased exposure to drugs. The notification rate was also significantly higher for males and highest for people aged over 40.
The liver is the largest organ in the body and consists of functional parts called hepatic globules, which are made up of hepatocytes. The liver's main functions include filtering the body's blood and detoxification, metabolizing nutrients for the body to use for energy and storage, forming proteins important for blood clotting such as albumin, and producing bile, which is released into the small intestine to help digest fats. Following transmission, HCV reaches the liver via circulation and on the surface of hepatocytes binds to CD81 molecules which act as viral receptors. It facilitates HCV's entry into the liver cell by endocytosis. HCV then replicates by hijacking the hepatocyte's machinery using the ribosomes to translate viral proteins. Following entry, the innate immune system is activated via recognition of Hep C's viral molecular patterns by receptors such as RIG1. This causes the secretion of interferons which signal to immune cells like natural killer cells, which destroy hepatocytes by cytolysis, causing inflammation.
However, HCV can evade innate immunity as it counteracts the RIG1 pathway due to its non-structural proteins activating a protease, which cleaves as stimulator of interferons and antiviral genes.
So this leads to chronic hepatitis C in many patients. Also via the adaptive immune response, HCV's viral peptides are presented as foreign antigens on the hepatocyte's cell surface by MHC class I molecules. This activates CD8 T cells to destroy the infected hepatocytes via cytotoxic killing. This leads to further inflammation and apoptosis. Dendritic cells can then present fragments of infected cells to stimulate further T cell activation. If the T cell response isn't strong enough, HCV won't be cleared and will lead to persistent infection. Over time, the repeated self-mediated immune destruction of infected hepatocytes lead to fibrosis due to apoptosed cells being continually replaced with excessive scar tissue. This can lead to cirrhosis and even hepatocellular carcinoma as the liver homeostasis is continually disrupted. The viral core protein is also responsible for causing insulin resistance, which leads to increased lipogenesis in the liver, resulting in fat accumulation and eventually hepatic steatosis. This ultimately leads to progressive liver damage and dysfunction. In the acute phase, symptoms are usually mild or absent, consisting of fatigue, loss of appetite, muscle aches, joint pain, nausea, and fever. These symptoms are the body's reactions to the immune system activation. During the chronic phase, More severe signs and symptoms develop, such as jaundice, a yellowing of the skin and eyes, which occurs due to the accumulation of the yellow waste product, bilirubin, in the blood. Mental confusion and difficulty concentrating due to toxin buildup in the brain. These are both due to the liver's decreased ability to filter the blood. Fluid buildup in the legs and abdomen may occur due to increased pressure in the portal vein and the inability of the liver to make albumin. This inability to make these clotting factors may also contribute to increased bleeding.